Welcome back to my channel. Today, we're discussing a critical shift in the availability of COVID-19 vaccines that has significant implications for uninsured and low-income Americans. Previously, COVID-19 vaccines were widely accessible for free through the Federal Bridge Access Program, which aimed to provide coverage for uninsured and underinsured individuals. However, this program has recently ended due to funding cuts, leaving many without a safety net to cover the cost of vaccines. Now, the price for a COVID-19 vaccine can reach up to $200 for those without health insurance. This change comes at a time when COVID-19 continues to cause serious health issues and hospitalizations, despite no longer being classified as a public health emergency. The end of the Bridge Access Program means that people like Nicole Savant, who lost Medicaid benefits and faces financial difficulties, are struggling to afford the vaccine. Savant was quoted $201.99 for a vaccine at a CVS, a cost that she finds prohibitive given her tight budget. The expiration of this program reflects broader issues with healthcare accessibility. Approximately 25 million Americans lack health insurance, and many of these individuals are more vulnerable to COVID-19 due to poor overall health and reluctance to seek medical care. Despite the challenges, there are still some options available. Private insurers, Medicare, and Medicaid are required to cover the cost of COVID-19 vaccines. The CDC has also allocated $62 million to support vaccine distribution through state and local health agencies. However, this funding is insufficient to meet the total need, leaving many in limbo. Community health centers, which previously provided a substantial number of vaccines, are now facing cutbacks and will need to rely on local health departments for supplies. This shift underscores a troubling trend where financial capability increasingly determines access to health care. Pharmaceutical companies like Pfizer and Moderna have patient assistance programs that offer vaccines at reduced costs or for free, but details about these programs are limited. This situation highlights a gap in coverage that could leave many people without access to essential vaccines. For those who lost insurance or are facing financial difficulties, like Adriana Ruiz, the costs of vaccination can be overwhelming. Ruiz, who was laid off and lost insurance, is now exploring subsidized insurance plans and taking precautions to avoid COVID-19 on an upcoming trip. Health workers like Shannon Donnell, who are contracted without health benefits, face their own challenges. Donnell plans to cover the cost of the vaccine out of pocket, despite high monthly premiums and deductibles for health insurance plans available through the Affordable Care Act marketplace. The discontinuation of the Bridge Access Program has also affected international visitors and undocumented immigrants, who previously had access to free vaccines. This change puts an additional burden on these already vulnerable populations. The shift from free, widely available vaccines to a more traditional, insurance-based model highlights the ongoing disparities in healthcare access. While the urgency of the pandemic has lessened, the need for accessible vaccination remains crucial, especially for those at higher risk of severe disease or long COVID. As we navigate this new landscape, it's clear that ensuring equitable access to vaccines remains a significant challenge. If you found this update informative, please like, share, and subscribe for more content on the latest health news and developments. Stay informed and stay safe.